What makes Rago and Associates so good at treating eating disorders?
Rago and Associates really excels at treating eating disorders because of our knowledge, our years of experience. Many of our staff has already worked in eating disorder hospitals previously, so we know all the levels of care that are available, and we like to work with our clients step by step. I would say because of our expertise, many of our clients, they don't go to a higher level of care, but if that does happen, we know where to go. We know what steps to take. A lot of families, they'll call us and they say, we don't know what to do. We're overwhelmed. We don't know where to go. And I think we want to strive to be that bridge for you, to be like, we know where you can go. We know how to help. We know what steps to take. We know how to find out what to do next. And so we want to take some of the pressure off parents so they can be parents, and that we can be, the professionals that know what steps to take and where to go. So I think one reason we excel at working with eating disorders is having all the knowledge of all the types of levels of care that there are. We're very well trained in all the types of therapies that exist for eating disorders. We know when to use which ones, and we also can use them and apply them in more sophisticated ways. Because, for example, we would always be cautious. We don't just use a manual. We know how to use the manuals for therapy, but we would be watching out to make sure this is a self-esteem building experience. This is a positive body image experience. Many professionals work with eating disorders just with talk therapy, just with talking about your feelings. It's not effective. It's not I'm not saying you can't talk about feelings, but you also need to bring a dietitian to give that structure, to show maybe I don't want to throw up anymore. Well, I don't know what to do to stop. And there is a role for talking about feelings, but you also have to know, what can I eat? How do I not gain weight? Obviously, people with eating disorders, many of them are very worried about what weight they are or what weight they should be. And so to have that directly managed with an individual dietitian, it makes a really big deal. So Rago and Associates, we love to create intensive treatment programs, some IOPs, as alternatives to some of the more structured programs that exist in hospital systems. So, for example, maybe there's an intensive outpatient program at a hospital or a treatment center, but it's all group. Everything is you go from 5 to 7, but it's a dinner group and then it's 2 groups. Are you really getting your individual needs met? Where for us, we feel like we don't really want you in that group with everyone's talking about things they might not even relate to you. We'd rather maximize your time to talk about what you want to talk about and set your goals and work on any obstacles that are in the way and just help you meet them. So when you add whatever somebody needs, if you wanted to add yoga therapy, if you want to add equine assisted therapy, if you want to add beautiful art therapy, family therapy, couples therapy, we don't just sit there, sometimes people are like, 45 minutes a week. And I'm not saying you can't do 45 minutes a week, because some people, that's what they need. But when issues become really unmanageable and they become, they're very overwhelming to a person, I want to create something special for them to get them, to help them go in the right direction, help them meet the goals that they set. And also, I would want that person to have a self-esteem building experience along the way. So sometimes people, they might come to therapy because they're just a professional person, but they're just not as efficient with their time as they would want to be, and to create that environment where so we're not saying everyone has to have mental health issues either. Sometimes people might just want to have an environment to talk things over. They're building their company. They want to figure out the right ways to do it. We want to help whatever people are striving for. So sometimes people have very significant mental health concerns that we want to alleviate for them. And some other people, they just want to enhance their life. They want more like a life coaching experience where they just want to be most effective at every area of their life. So we love to do both of those. We love to help people that are really struggling, and we love to help people that are doing well, but they want to improve different performance in areas of their life.